Okay. Thank you, everyone, for deciding to join today's webinar. Today, we're going to talk about the connections between body image and hair pulling. My name is Dr. Sofia Wenzler. I'm a licensed clinical psychologist and the clinical lead here at Trichotillomania, the program that combines online therapy elements with assistance with personalized therapist assistance. I'm gonna do a presentation that's gonna last for about 40 minutes, and I want to encourage each and every one of you to stick around until the end because we're gonna have a Q&A session that is usually very interesting, where you can ask all of your questions. You can write those questions down during my presentation in the Q&A section or afterwards. But I want to ask you to please not raise your hands, just write down the question, and I will go through the questions question by question, and I will answer as many of them as I can. Also, another little thing to look forward to at the end of the presentation is a promo code in case you decide to sign up to our program, Trichotillomania. You're going to get a promo code that's going to give you a $100 discount on your first subscription. All right. Gonna just check. All right. So in the beginning, I want to talk a little bit about what beauty means and where beauty standards come from and how they are connected to body image. Then I want to talk about the overlaps and the connections and the role that body image basically plays for hair pulling disorder. A little bit about hair pulling and body dysmorphia, which I'm going to obviously explain what it is. And then I also want to give you my 5 cents on how to find a healthy relationship to your body, which is really not easy these days, but maybe I have an idea or two that's gonna, benefit you, because I always want you to also take something practical away from those webinars. Okay. So, beauty standards, and why do we have them, and are they important? And I know we have many beautiful sayings in our language, just like beauty lies in the eyes of the beholder, do not judge a book by its cover, which kind of can make us feel as if we're maybe even superficial, or if we care about beauty, it's too much and we're supposed to not care about it. But that's actually, against human nature. It lies within, and it has always lied within human nature to seek for beauty not only in each other, but also in art, in nature, in music, in poetry, everywhere, right? So it is human to care about beauty and to seek beauty and to enjoy beauty. Also, unfortunately, I wish I could change that. Physical beauty and attraction do matter, and we know that from research. That's why maybe one of the reasons why it also takes up so much space in social media, in our culture, in our minds, right? So people perceived as attractive are considered by others as more successful in their professional and personal life. Being considered beautiful or attractive is associated with overall well-being. People that are considered as beautiful or attractive are perceived as more intelligent. They tend to marry beautiful partners, and then also tend to be hired more frequently, receiving better performance evaluations. And I could cite more research here, but just another interesting aspect: people considered unattractive are more often found guilty and have received longer sentences in trial than people who are perceived attractive or beautiful. It's basically in the word itself already attractive. Like you draw people in, you have something pleasing about you, and that has an effect on other people. So to care about beauty makes sense, and it's a little bit part of our nature. And to say that, you shouldn't judge a book by its cover, obviously you shouldn't, but the cover does matter and makes a difference. Um, where do beauty standards come from? So, what is commonly talked about a lot are trends in beauty standards. There are trends that change over time. We see those pictures of, actors or actresses more exactly from the 50s that had more curves than what we consider as beautiful, or that what we consider as the standard for beauty today. And in the Middle Ages, there were different beauty standards than today. And also beauty standards can differ from culture to culture, right? The things that we consider as beautiful, for example, in Germany might not be the same that we consider as beautiful in China. And that's true. And there's variance in there, but there are also beauty standards that have been quite stable over a long period of time. And the idea behind it is that those beauty standards are based on evolution, that there are certain features in our bodies or appearance that might hint towards fertility. And that's why over generations and thousands of years of evolution and survival of the fittest and everything, um, we have learned as humans to be attracted to those features. And those include facial and body symmetry, clear skin, also as a sign of health, the waist to hip ratio in women as a sign of being able to birth children, youthfulness, because generally, and this is also, again, mostly for women, young age points towards higher fertility. And then in men, beauty standards are a little bit different. They don't necessarily have to point towards fertility. They point more towards status or the ability to provide, which used to be very important when work included actually hunting or physical work, which today in many cases doesn't anymore. So in men, general and stable beauty standards are muscularity and height, because they point towards the ability to provide physically. So those are stable beauty standards that are recognized in many different cultures and over time. And as you see, for example, with facial symmetry or height, there's a lot of those where we don't really have any control over, although they might affect, how we are perceived by others. And yes, things like confidence, humor, or friendliness can also make you attractive to another person. But whether the body we are born with is close to the beauty standard in our community or the general beauty standard is not something we can change, right? But what we can change is the way we look at our body and the relationship we have with our body. And that's not always necessarily connected to whether our body is close to to our own beauty standard or not, interestingly. And I'm going to get to that. So body image is the idea that I have in my head of what my body looks like. And you would think, what does that mean? Like if I look in the mirror, I see my body, and that's the idea of what my body looks like. So like, is my body image not just the way that I look? Well, it's not, because not only can you really physically, visually perceive your body differently on one day in comparison to the next, which I'm going to explain now soon. But also body image includes the attitude I have towards my body, right? And two people can look very similarly, but still have different attitudes towards their bodies, or different levels of satisfaction with their bodies. So it is something also influenced by many things, my beliefs, life experiences. I could go in more detail but I'm not going to do that because we don't have the time. And it's actually quite common to not be happy with, to have, to be dissatisfied with your body, what we call body image disturbances. That is very, very common. And unfortunately, it's become more common over time, most likely influenced by things as social media and stuff like that. Women suffer more from body dissatisfaction than men. But there is a slight shimmer of hope for you personally. So while over generations, body image satisfaction has decreased for you personally, for every person, generally the what do you call this? The tendency, the evolution of your body image is a positive curve. Wow, that was really weird to say that. So generally, over time, for one person, body satisfaction improves. So each and every one of us has statistically the chance that in 10 years, we're going to like our body a little bit more than today, no matter what it's going to look like. Generally, bodies don't become more beautiful over age, at least when you're an adult, but body image improves slightly with time, which already points towards the fact that it's not always related to the way you actually look. So those are general tendencies and movements there. However, body image is not as stable as we actually think. In fact, from day to day, the way we perceive and the satisfaction or acceptance we have for our own body can be very different. And that's based on many changes that we undergo from day to day. So hormone changes, the cycle can largely influence how happy we are with what we look like. But even minor things, just as the lighting, the angle, or the mirror that we're looking at. We generally have a better body image after exercise, after having a good night's sleep, and when we're hydrated. If we're happy and confident, we also are more satisfied with our body. And also there are certain styling choices, things that you can choose to wear that make you feel good about yourself, that will literally change the way you perceive you're seeing your body in the mirror. Okay. And I'm sure a lot of you have had this experience that one day you wake up and you look at exactly the same body and you're like, oh, that's okay, and you're happy about it. And then the next day you wake up and you look at yourself and I'm like, wow, I'm going to leave the house. It's the same body, right? Isn't that crazy? So we're looking, when we look at body image, we're looking, I try to kind of visualize that at two connections, okay? So we have body image in comparison to what we actually look like, or real body. Our real body is probably looking quite the same. It's probably the way we look is probably very stable over time, but our body image can fluctuate and be influenced by all kinds of things. And then we have our body image, the idea of what we look like in comparison to beauty standards or our own ideal of what we want to look like. And there can be difficulties or problems arising from in both directions, right and left here. So first of all, what do we do? Or what happens when the idea that we have of our own bodies or body image feels very far away from what we perceive as ideal or where we want to be? Beauty standards, right? And when we talk about beauty standards, we're talking about unrelenting standards and unattainable goals. I think it might seem logical to you, maybe not, but it's something we constantly forget, that beauty standards are not something that we can reach most of the time, right? First of all, because beauty standards change, so it's not even a stable goal, but even more so because what we see specifically in the news, on TV, on social media, the pictures that we compare ourselves to are not even a realistic depiction of the person we're seeing. And today there's more awareness for that, and there's some brave actresses who show us what they actually look like in reality. So we're fighting against, pictures and ideas that are not real, that are created by filters and photoshopped. I was really trying to find a picture like that also of a man, but I couldn't. But I'm sure that also there's pictures out there and on magazines of men that are photoshopped, maybe just not as much talked about. So that's something that a lot of people know at this point. Hopefully, now you know. It's not real. You're comparing yourself to something that doesn't really exist. But I think for me, the biggest lie that media or diet companies or whatever tell us is that the closer that my body or the way I look at my body is going to be to an actual beauty standard, the happier and more satisfied I am going to be with it. If I do the diet, if I tone my body, if I do the surgery, I will look differently. I will be closer to my own ideal, and I will be more happy. So first of all, this bears the illusion that we can just shape and change our body whichever way we want, which is really far from reality. But also, it's not true. The closer you get to achieving an ideal beauty standard, the more you actually focus on your body, and the more you focus on the imperfections and the things you want to change. And that actually draws your attention towards the negative, and there's a huge risk for you to be less and less satisfied with your body. Maybe you've had this experience of, for example, losing some weight, and after a few pounds, you start being happy with yourself, but it's never enough. You always have the next goal. Okay, I could lose a little more, or I could have more muscle on my belly, or stuff like that, right? So the closer you get to your beauty standard, doesn't make you less necessarily more satisfied with your body. Sometimes it even has the adverse effect. And we also see that in groups of people that actually supposedly, statistically, are very close to beauty standards. For example, ballet dancers or models, they're supposed to be very close to the beauty standard, but specifically in those groups, you see a lot of dissatisfaction with the way you look. And that's paradoxical, right? But then we see the next advertisement for a diet or for a beauty product, and we're in this, hamster wheel again of like, I just have to work harder, and I just have to change my body a little bit more, and then I'm going to be more happy with it. But it's not true. That for me is one of the biggest lies, I guess. So that would be the problem between trying to make our body adhere to beauty standards, which again, the idea of wanting to do that makes sense because beauty matters, but there is much less control there than we actually think. And it doesn't necessarily mean that it's going to make you happy. But also, interestingly, and maybe less known to some of you, there can be huge gaps between the idea we have in our heads of our body or body image and our real body. There can be huge gaps between that. And that's something that we call body dysmorphia. And I'm going to talk about that more briefly. Just a few words about the connection between body image and hair pulling before I go into that. So if you think about the fact that hair pulling is a grooming behavior, then the connection between body image and hair pulling actually makes a lot of sense. So grooming is a behavior that an individual or social behavior, right, meant to make us presentable and fit to be part of a group in terms of our appearance. Grooming is is directed towards our appearance. And hair pulling can be looked at as kind of a grooming behavior that got out of hands and that all of a sudden serves all kinds of other purposes, but at its core, hair pulling is a grooming behavior, nail biting is a grooming behavior, skin picking is a grooming behavior, all of those body focused repetitive behaviors. That's also why oftentimes they first, appear in adolescence, because that's the time when we also learn as humans to take care of our adult body. And that's when those things can get out of hands or we can overdo things. So in its core, there's already a connection between body image or taking care of our appearance or caring about our appearance and hair pulling. If we look into we look into what we know from research in terms of body image and hair pulling, then there is usually a negative connection. Women and men with body-focused repetitive behaviors, such as hair pulling and skin picking, usually perceive themselves as less attractive than individuals without it. So they have more body image disturbances. Individuals suffering from any body-focused repetitive behavior have more body image concerns, and BFRB severity is associated with, as I said, body image disturbances, lower self-esteem, and lower subjective physical well-being. So generally, if you have a hair pulling disorder, then you have a higher likelihood to be dissatisfied with your body and have body image disturbances. That's why I want to give you some advice at the end of this webinar on how to improve that relationship with your body. And why is this connection? There's not really, we don't know for sure, but there's theories or kind of just logical trains of thoughts. So for example, hair pulling can be caused by dissatisfaction with appearance in an attempt to fix imperfection. So maybe it's even the body image disturbances are there first, and the hair pulling disorder builds on it, right? But also in return, hair pulling can lead to bald spots and visible signs, which likely affects how somebody evaluates his or her body. I saw a raised hand. I'm not gonna react to raised hands. I just want to check that there's no. I'm always scared that someone writes in the Q&A that you can't hear me, and then I'm just talking to myself because I can't see you guys. But there's nothing in the Q&A section, so I guess you guys can hear me. So if you have a question, please write it down. Don't raise your hand. Another connection between hair pulling and body image is that thoughts about whether others notice or the fact that they actually sometimes also do can reduce feelings of confidence in one's appearance, again, affecting our body image. But most importantly, and that's something I'm going to elaborate further later, individuals who pull their hair tend to spend more time preoccupied with their appearance. And that's the main problem that causes body image disturbances. And we're going to get to that, but bear in mind. Okay, body dysmorphia and hair pulling disorder. So body dysmorphia is this idea that our body image, the idea that our body image is actually is worse, or we have a perception of our body that is actually very far away from what we really look like. This gap between our real body and the idea we have of it. And body dysmorphia is kind of a symptom that you find in several mental health disorders. It's very common in eating disorders such as bulimia and anorexia. In those cases, it's mostly body dysmorphia concerning weight. So for example, people who have anorexia are usually very thin, right? But when they look in the mirror, they're really, it's not that they exaggerate, they really see themselves as fatter than they actually are. And there's experiments, for example, where you can put a rope in front of a person who suffers from anorexia and ask them, okay, how long would the section of the rope have to be that you hold with it in between your arms, your hands, in order to wrap it around your waist once? Estimate without wrapping it around your waist, just estimate how long it would have to be. And usually they estimate much longer section of the rope that they would actually use. And they are surprised themselves when they put it around their actual weight, because the idea they have of their bodies is really not close to reality, right? And the disorder that literally makes the symptom a disorder is body dysmorphic disorder. So for body dysmorphic disorder, body dysmorphia is the core and most important and defining symptom. Body dysmorphic disorder is a condition characterized by intense and persistent preoccupation with perceived physical flaws, often minor or unnoticeable to others. And in addition to this preoccupation, to this concern, people with body dysmorphic disorder spend significant amounts of time obsessing over these perceived flaws. And there's some overlap between body dysmorphic disorder and hair pulling that I want to talk about. I just want to mention I put hair pulling and skin picking here. Body dysmorphia is not a main symptom of hair pulling, but appearance concerns are kind of part of hair pulling disorder many times. And there are some similarities between hair pulling disorder and body dysmorphic disorder that I want to talk about. So actually, there's also a co-occurrence. So 9% of people who have hair pulling disorder also have body dysmorphic disorder. So about every 10th person with trichotillomania will also meet the diagnostic criteria for a body dysmorphic disorder. And in terms of the symptoms, there's overlap, because in body dysmorphic disorder, as well as hair pulling disorder, we see intense worry about a specific body area and focus on that one. Comparing your looks with other people's looks, mirror checking, and trying to conceal perceived flaws. So this element of preoccupation is something that both of them have in common. And you might ask yourself, but and by the way, with body dysmorphic disorder, obviously this doesn't have to be, the flaw can be anything. It doesn't have to be related to hair. It is oftentimes a flaw that we find in the facial area or on the head somewhere, but it can be anything. I had a client whose body dysmorphic disorder was around having tiny hands. I had a client where she felt that one half of her face just looked significantly different from the other half, and that made her look really weird. And you might ask yourself, how do people, lose touch with reality in terms of this perceived flaw? Why would they see something in the mirror that's not really there, or exaggerate something that is minor so greatly? And this is another point where I see some overlap between BDD and hair pulling, because both of them are compulsive in nature. Compulsive meaning it's kind of the cycle of an urge comes up. For example, an intrusive thought about the perceived flaw for BDD, or seeing your hair when you want to pull, or some tickling somewhere, or the triggers, as you know, can be manifold for a hair pulling disorder. And then you give into the urge to relieve some kind of tension or distress. But in the long run, you do it over and over again. And what happens is that you are really preoccupied with this thing. For example, you can be really preoccupied with your hair or with your brows when you have hair pulling disorder. And obviously the preoccupation with the perceived flaw in body dysmorphic disorder is part of the definition. And what happens is the more I check on some aspect of my life, for example, a detail in my appearance, the more concerned and unsure I will feel about it. The more I check, the more I preoccupy myself with it, the more unsure I will feel about it. The more I look at my hair or this part of my body, the more flaws I will find. So the more I actually look at the thing and deal with the thing and preoccupy myself with the thing, the less I will have the less realistic and based in reality my perception of it will be. If that makes any sense. Just like almost like in OCD, when we know so one of the compulsions in OCD can be to check, for example, the stove. When you leave a house, you might have an intrusive thought of like, did I leave the stove on? And we know that the more I check, the less sure I will feel about whether the stove is on and off, which makes no sense. I mean, you should think that when I check for the 10th time, I'm more sure than when I check for the first time, but it's not true. The more I preoccupy myself with something, the more I check, the more unsure I will feel about it. And I think that's something that's at the core of body focus, but of body dysmorphic disorder, and can also play a role with hair pulling. So preoccupation with the way I look is the main culprit of disturbances in body image. Again, what logically we would think the better I look, the more happy I'm going to be with my body. But that is not true. If that were true, people like models, actors, belly dancers should be very, very happy about their body, but they usually aren't. Why? Because their job forces them to be preoccupied with their looks all the time. Because their job forces them to look at their mirrors and focus on their flaws, fix their flaws all the time. And that leads to them being actually less happy. Not all of them, of course, statistically, right? So it's the preoccupation that we have to limit if we want to improve our body image, in my opinion, and also many other people's opinions. A guide to feeling bad about your body. So what are those actions of preoccupation that can lead to disturbances in body image? So when you're on diets, weighing yourself, checking your body again and again, looking at beauty magazines, if you're old school, or social media, and comparing yourself to what you see there, that's preoccupation with your body. Generally, comparisons, social comparisons, comparing your body with other people, looking at mirrors in general. Evolutionarily, we're not supposed to be confronted with the way we look over and over again. Evolutionarily, there were no mirrors, right? We, at some point in human development, the only way to see our bodies was to see ourselves or a reflection in a sea or something like that. I'm sure people were less preoccupied with the way they looked back then. Certain clothes that we constantly check whether they're in the right space or whether we're covered, can make us preoccupied with the way we look. Video calls, Zoom, big problem. When others talk about our bodies, when others talk about their body, can also make us think about our body. Having our picture taking, focusing too much about on specific body parts, and focusing on fixing things, such as we do in hair pulling disorder. All of those things worsen our body image. And that's why if you think about, okay, the first thought, if you think about what can I do to improve my body image, very important, image, not the body, is to reduce those activities. And this is where we see overlap also between how we treat, for example, body dysmorphic disorder and hair pulling disorder. Stimulus control techniques, as we, for example, use them in TrickStop in the program that is bringing this webinar to you, include dimming the lights, reducing time in front of the mirror, and reducing selfies and video calls, because that worsens your hair pulling, but it is also not good for your body image. How are we time-wise? I have 5 minutes. I'm gonna go a little bit over time, I think. I want to give you a little bit of advice when it comes to finding a healthy relationship with your body. This is kind of advice based on my own experience as as a clinical therapist. Some of this is also research-based, but generally we don't have, a protocol. Like we have, CBT protocols to treat hair pulling, as you know, because that's what we use at Trickstop. We have CBT protocols to help with anxiety and depression. I don't think there is one for body image. So it's more kind of like an eclectic collection of things that I find that help my clients to change their relationship with their body. I want to talk briefly about body positivity. That's a whole movement with very good intentions, the acceptance of all bodies, regardless of size, shape, skin tone, gender, and physical abilities. And that's amazing, right? I mean, that's the best possible idea, to just have a positive image of your body, be happy with your body, no matter what it looks like, and no matter how far or close it is to a certain beauty standard that I hold. For people who just say, can let go of all of those beauty standards, of all of those influences by other people, by social media, by TV, and just find a positive relationship with their body, that's amazing. In my experience, for a lot of people, it's actually just the next unattainable goal. Like, okay, we used to say you have to look a certain way. Now you can look whatever way you like, but you have to love your body. That's really hard when you've been primed to think you should have a different body from a very, very early age. And it can lead to, you can, it can make you feel bad. It can make you feel, it can make you push you into trying to feel something that you don't really feel. And also you're still preoccupied with your body. Instead of focusing on your flaws, now you're focusing on trying to really love your body, look at your body, love every aspect of it. So for a lot of people, it's not the way to go. What I find much more healthy is the idea of body neutrality, which is fairly new, kind of term that started to surface around 2010. And an approach that emphasizes neither a positive nor negative feeling or attitude towards your body, but rather a neutral acceptance-focused mindset. So the idea, I don't have to love my body, and I don't have to think about whether I love my body or whether other people love my body or the way I look all the time. I can just not think about it that much, and I can reframe it. By shifting my focus, right? I once saw a really beautiful post by a young actress that had given birth, and she was talking honestly about stretch marks. And when I prepared this presentation, I tried to find this post. Obviously, I didn't find it. Maybe it was just a story or a reel. I couldn't find it anymore. And I looked for it online, and I typed into Google. I took a screenshot for you of that. Reframing stretch marks. The idea of like finding a different relationship with the stretch marks on your body. And this is just the first 3 results I got, but basically for a long stretch of time, the only thing that came up were where do they come from and how to get rid of them, how to get rid of the stretch marks. There's something not beautiful on your body, you have to get rid of it, which is insane because to my best knowledge, you cannot get rid of stretch marks. They go away by themselves or they stay. And a lot of times they stay. And you have to find some way of accepting it. But if you look it up online, what you find is just false ideas of what you can do with it. So I think, long story short, I think this actress called them love marks, but actually their idea is just to find a different way to relate to it. So I made up my own. So instead of like hating your stretch marks, why don't you ask yourself, what story do my stretch marks tell about my life? What are they a result of? Other questions. How many days and nights has my skin seen already? What kinds of things did my skin see over the last 30 something years of my life? How many miles have my legs carried me over the years? How many things can my hands create? What does it feel like for another person to rest their head on my belly, right? think about your body differently in terms of what it does for you and what it's capable of doing and what it's already done and things it's gone through. Your body is not only the way you look. So that's one aspect of body neutrality. You can change your inner dialogue, right? What defines me as a person? I'm not my hair, I'm not my bald spots, I'm not my cellulite, I'm not my acne, I'm not my scars, I'm not my weight, right? A lot of times, women in the media get reduced to their weight, just like in this picture with the Kardashian family. But as a 90s kid growing up old school with, with like those magazines, that's something that was almost in every magazine. Oh, Britney Spears lost weight, she gained weight, she was 58, now she's 72, she was 72, now she's 60, 55. And what is her, secret? We're so trained to look at our bodies in terms of what it looks like and how heavy it is. And that is really frustrating and makes you really angry. And it made one specific person very angry. She's called Jamila Jamil. And she started a whole movement around it of like, let's reframe that. Let's not look at our worth in terms of what we weigh. And she called she didn't call it that, but it became the I weigh movement. What do I weigh specifically as a woman, except for my weight? And you see here, actors and famous women picking it up and thinking about it. And I actually, I find this a very powerful way to look at yourself, um, and to reframe this focus on of what we look like. Um, and I would love to take a moment for you to think about what do you think you weigh? What makes you you, except for the way you look, like the way you look, the things you did you were proud of, the people that love you, the people who helped you become who you are, that shaped you, the challenges in life you overcame or coped with, things that make you happy, the person you are for others, and your strengths. How would you fill this picture if it was you? That's maybe a little exercise you can take home, and do with yourself. But yeah, by switching the focus and being less preoccupied with the way you look, you might actually end up being more happy with what you look like. But don't think you have to love your body every day. You don't have to love your body every day. You can have days where you love it more and days you have where you love it less. You can love some parts of your body more than others. But m most of all, stop preoccupying yourself with it. Um, just another tiny intervention that I love to do with teenagers also, who are obviously very preoccupied with what they look like and fitting in and all of those things, is take a picture of a group of people. I just took this off a place where you can download pictures for free, and ask yourself or ask another person, look at those people and think about which one of those, without actually knowing them, would you want to have a coffee with? Or which one looks like they might, you know, you might be want to be friends with them. And then, you choose one and then you ask them why. What is that? What attracts you to this person? And then they might say all kinds of things like, oh, they have a friendly smile. I love the style. They just have a vibe around them. It's the print on their t-shirt, whatever it is, but it's usually not their thigh gap or their weight or whether they have a pimple or not. And that also kind of, puts you more in portion in terms of how important those things that we strive for so much as people really are. That's it for today. Here are my takeaways. There are evolutionary and cultural beauty standards. Wanting to feel beautiful is not vain. It makes sense. So don't judge yourself for it. However, the way you feel about your body is not necessarily only influenced by the way you actually look. It's influenced by many factors, and it's not even stable. Preoccupation with your appearance can lead to low self-esteem and lack of self-confidence and body dysmorphia, much more than a few kilos more or less, or clear skin or acne. The way you look or your perceived flaws don't define you. Attaining a better body image is through changing focus and mindset, not through not through trying to change yourself. I don't even want to call it make yourself look better, because we really have limited control over that. If you're interested in Trickstop, by the way, the program I mentioned briefly, you obviously know we have monthly webinars, but also we have a website, trickstop.com, where we upload blog posts about interesting topics related to Trickstop. We upload new blog articles every month. We have an online forum, and we are available and present on all the social media channels. That's a great place for you to find community and get information and stay up to date. All right, that's it for today. Let's see if we have any questions. Oh, that's a good one. Are affirmations helpful? And please write down the question in the Q&A section. The Q&A section, if you have trouble finding the Q&A section, you can go to the kind of tabs up on your screen, and there's a circle with 3 dots, right? You click on that, and then you see Q&A, and that's where you can write down your questions. Okay, are affirmations helpful too? To be honest, I don't have any research on how effective affirmations are, which I'm pretty sure I'm not sure there's research out there. I don't know of any research of affirmations. So basically, I'm going to answer in terms of my own opinion. I'm not a big fan of affirmations. I feel by saying something several times, it doesn't mean that it becomes true or that you start believing it. So I think a much better tool when when you're dealing with something difficult, or you want to create some space where you're good to yourself, or then I would advise doing a self-compassion exercise instead of affirmations. Which is to say, I do have clients who do affirmations and they find it helps them. But I personally don't give it as an exercise. I feel like yeah, as I said, I don't think that by repeating something many times, it becomes true, or we will believe it or feel it. What I do think is can be helpful is, for example, standing in front of the mirror and looking at yourself and smiling at yourself, straightening your posture, like feeling, kind of creating a certain feeling in your body through standing up straight, looking up, smiling. That's something that momentarily can affect the way you feel. Okay, another great question. What is something, for example, a little mantra we could say to ourselves when looking in the mirror, seeing hairs that we desperately want to pull? That's an amazing question. Let me think about that. So in that case, you're not even talking about body image. You're talking about kind of a mantra you can tell yourself if you want to deal with an urge. Pull. Um, like my first impulse was to, for example, to say I can breathe through this. Um, I can breathe through this, but that's not always true. I mean, like if we could always automatically just resist the urge, the disorder would be much less common than it actually is. Um, Maybe one mantra is like if you try to resist the urge, you can tell yourself a mantra that it's gonna get easy, it's gonna get a little easier every day. Or I'm taking a step every day. Something that reminds you of the fact that if you continuously work on something, if you continuously try to breathe through the urge or practice stimulus control or practice competing responses slowly but consistently, you will get better at it. So I think that's something that I would want to remind myself of in terms of a mantra. As long as I keep going, I'm going to make progress. Maybe something like that. But it's very individual, obviously. But I think the idea of having a little mantra that you can tell yourself in that moment that kind of anchors you and connects you to your to the self-compassionate and healthy parts of you, that's a good idea, I think, always. Not a question, but I like to tell myself it's just the hair when I'm having a hard time resisting pulling out a specific hair. Yeah, I like that too. It's just the hair. This hair doesn't define me. Um, Thank you. Thank you for contributing this idea. Okay, we still have a few minutes left. Any more questions at this point? Oh, another great question. How do we get over the feeling of not being normal for pulling? I would say there's two things, okay? Because you're calling it a feeling of not being normal. Not being normal is a thought. I have the thought, or I believe the thought that I'm not normal for pulling. And I would say the underlying feeling would be embarrassment or shame. Um, and in order to kind of challenge this thought, remind yourself that you're not alone at all with the hair pulling. You feel alone because it's stigmatized and people don't talk about it, but it's not true, right? We know that prevalence lies somewhere between one, 1 to 4, I think, percent, which means in a group of 100 people, there's at least one, I think, more people who have the same problem as you. That's about as prevalent as OCD, which is talked about so much, right? Um, Hair pulling disorder is just more stigmatized and less known at this point. So first of all, you're not alone. Second of all, what is normal? At this point, we know that about 40 or even more percent of the population of people in Western societies have some kind of mental health condition in their life at some point. That's almost half of them, right? So what does normal even mean? You have a condition. It's not your fault that you have this condition, and there is nothing weird about it. It's just that a lot of people don't know about it. So that's, I think, the way I would challenge this belief in terms of the way I think about it. And if you want to challenge the embarrassment or the shame, then the best way, in my opinion, is sharing it with other people. Talking about it with other people, I know that's super, super hard, but the more you make the experience of opening up, sharing it with someone else, and someone else not looking at you as if you're not normal, hopefully, which is, I know, not always the reaction, but a lot of the times that's the reaction, that can really help you deal with shame. For example, if you, for people who join our program, we have support groups. That's a great space to open up and share about it and just normalize it for yourself. Have other people look at you and give you the feeling you're okay, I still love you. That's going to really help you reduce feelings of shame, but also self-compassion um, is a really great way to reduce shame or to deal better with it. And we have dedicated webinars to that in the past. Um, Another great question. What can you do if you suddenly have the urge to pull? Well, there are many things to do about that. Basically, habit reversal training, the kind of most effective way to treat hair pulling disorder is all about what to do with this urge. Um, Mostly once the urge comes up, we want to try to engage in some kind of competing response. So in terms of instead of pulling your hair, you want to do something else that helps you reduce the urge without actually damaging your body, without actually pulling out the hair. And that can be all kinds of things. And I really want to encourage you to check out, we have all of our webinars on our YouTube channel, and there are specific webinars on competing response and on habit reversal training. And there you're going to see a lot of options of what to do when an urge comes up. Another question, how do you avoid being hard on yourself when you try not to pick even for a few minutes and you still end up hair pulling? Amazing question. It's very easy to get into the space of being disappointed with yourself, feeling like a failure if you try to resist the urge and then you don't manage to. Um, and rest assured that you're not alone with this. That's why we call it a condition, because it's really hard to resist the urge. And beating yourself up about it actually just makes it worse, because then you feel bad and it even might trigger, another urge and another bullying behavior. So one way to deal with it is practice self-kindness and find kind of, even like as Karen mentioned before, a mantra that you can tell yourself to just beat yourself up less about it. For example, I cannot always win the fight, or step by step, one urge at a time, or things like that. And also remember that if you manage to fight the urge, even for a few minutes, if you delay the urge, the pulling after feeling the urge, if you delay the pulling even for a few minutes, you already practiced your muscle of being in this feeling of the urge and not immediately reacting, right? So you can also reframe, it's not always pulling is failure and not pulling is success, right? Sometimes it's okay, I didn't immediately pull, or I didn't pull as many hairs, or I was more aware of it. That's also a step. Or today I had 10 urges and I reacted to only half of them. That's also progress. So try to gain more flexibility if you look um, at those moments. Okay, one more question. I'm going to answer the last question. Do you have a webinar on relationships or dating with trichotillomania? I feel like when dating, my body image can be really negatively impacted. Like the previous person said, there is a lot of shame in hair pulling. Wow. Ah, no, you mean like the previous person said, There's a lot of shame in hair pulling. Sorry, for a second, I thought your previous partner told you that you should be ashamed of your hair pulling, which would have been horrible, but that's not what you're describing. No, we don't have a webinar on relationships or dating with trichotillomania. It's a great idea, though. I'm definitely going to keep that in mind. We do have webinars on, I think it's called something with support and trichotillomania, where I talked about kind of supporting a person with trichotillomania both ways. I talked about how when you have trichotillomania, you can learn to open up and talk about it with others. And then I also talked about how, the people who love you can support you. And that's where, for example, I also shared a really beautiful Reddit thread where someone, in that case with skin picking disorder, asked this question, like, how do I open up, to another person about my skin picking? And there were so many beautiful comments of like people who did it and where their partners were so accepting and really helped them feel better with their picking in that case. So you could check out that webinar for sure. I'm also going to consider doing one just in relationships and dating with trichotillomania. And also, yeah, I mean, I guess when you're dating, your body image can be negatively affected. You didn't go into much detail, but when we're dating, we also, we dress up, we look at our body in the mirror. So again, there's more preoccupation with the way we look like when we're dating. So also try to reduce that and try to remember that yes, first attraction is based on the way we look. But then if you are really looking for a relationship, that is built on totally different things. That is built on trust, on whether, your personality match. So many other things that define you will decide whether in the end you find a stable relationship or not. Yeah. All right. Well, thank you for those great questions, and thank you again for attending. I hope I see you in the next webinar, and I hope you have a great rest of your day in whichever time zone you find yourself. Yeah, see you in the next webinar.